Hello, welcome to our presentation on learning disability. I'm Andrew,
I'm Rolanda Lester.
and we're going to talk to you about some different parts of learning disability, from what it is to diagnosis and assessment, and some helpful tips for teachers, because there's a fairly decent chance that in your teaching career you will interact with various students who may have a learning disability. So we'll get
Mhm.
started, and I'll pass it off to Ro.
All right. Okay. Okay. Learning disability is generally a term that is described by specific kinds of learning problems a person can have trouble learning or using certain skills. The definitions of disability, the American with Disability Act, the past definition states that a person is blocking the words. I'm sorry, Andrew. The past definition state a physical and mental state that severely impacts one or more life major functions. This is a legal definition rather than a medical definition. The Americans with Disability Act present definition is a person with the physical or mental impairment that significantly impacts life capacity. And this can even include one who carries the label of disability. Next. A learning disability is a neurological state that affects the function of the brain to process or transfer information. The learning disability can be difficult to diagnose because the presentation doesn't always appear intellectually. Our screen is blocking our words here,
Can you
and
move
I can't
yours?
see the words.
Because like I can click and drag
Oh, I
our
got it.
around. Okay,
I got it.
there
I
you go.
got it. My apologies. The learning can be difficult. The learning disability can be difficult to diagnose because the presentation doesn't always appear intellectually, and the lack of ability in a certain area such as written language, arithmetic, and understanding usually shows up in early age, but it can appear later in adulthood. Next. The characteristics of the learning disability. This can be classified as mild, moderate, and severe, which commonly involves speech and written language, mathematics, and reasoning. In a moderate, it would show up a reading, they would have short term memory and problem solving, problems with comprehension, and those with the mild learning disability, um, they will have an independent lifestyle, but wouldn't have a lot of support, would have short support. The moderate would show up, it would be those who have that are intellectually have issues with tasks and can be have basic skills but need consistent support to achieve independence. Those with severe disability may have a lack of communication skills, even difficult with the most concrete skills. They can also have issues with motor and sensory skills. Their impaired judgment is off, and cannot live independently on their own and would need to be in a structured environment. The labels that are carried are dyslexia, which is the reading, and dyslexia in math, which they have poor reading skills and poor writing ability. The visual perceptual difficulties and visual motor deficits would have trouble with eye coordination and hand coordination when writing. Next. Educators have to be mindful of the learning differences in all students. Pigot's theory suggests one can only adjust to instruction given at the level of their learning development. And this is, when you when students come into the classroom at times, sometimes we're not aware of the student's learning disability until sometimes we see it on paper, or a student wouldn't readily say that they have difficulty reading or with math. So we have to be mindful, to look out for those things. The assessments are through testing and evaluation, medical records, interviews from professionals. A lot of times this is a hit and miss because parents are, readily don't know what learning disability looks like or what it appears like. A lot of them are in denial of this disability. So it has to take a lot of testing and, um, and for us to look for signs that are affecting their ability to write and learn, and even in other, motor skills that they have difficulty doing. Next, I think I'll hand this over to you.
All right, so thank you, Ro. That's a good segue into talking about assessment of learning disabilities. So during my research, I found that there's two fairly prevalent models when it comes to assessment of learning disabilities. So with these, you have the ability achievement model and the response to intervention model. Now, there's a lot of text on this chart that I made up, so I'm gonna kind of break it down for you. So the ability achievement model is a little bit of an older, dated model. It was developed by J.P. Doss and Arthur F. Bennett in the 1960s. In this model, there's a discrepancy between the individual's measured abilities, usually with an IQ score, and his or her achievement in school, and that discrepancy is used to diagnose and address various learning problems. So this model kind of functions based off IQ tests like the Wechsler Intelligence Test or the Woodcock-Johnson tests of academic achievement, which you may have learned about before in your undergraduate studies. If a child is not hitting a certain normative score for their age based on the IQ test, then they may be considered for an evaluation for a learning disability. Many schools have transitioned away from the ability achievement model towards response to intervention because RTI is a little bit more proactive and it offers gradual support to students, whereas the ability achievement model is kind of reactionary. So it fails to meet, kind of meeting students where they're at, and it waits for them to show a significant gap in their learning to make an adjustment and start the evaluation process, whereas RTI kind of gets into that a little bit earlier. So the law describes response to intervention in two ways, as a strategy for identifying students with learning disabilities and replacing the IQ discrepancy identification approach, which is the ability achievement model. And it's also a strategy for reducing the number of students who end up with a disability categorization, and it's part of guaranteeing appropriate instruction for all students. So this model is broken down into three separate tiers. You have tier one, which is a universal screener. This is a broad assessment of skills in the major areas of school like reading, writing, math, and science. And they use this screener to develop a baseline of performance achievement for all students at a certain grade level. So if a student is falling below the benchmark set by the universal screener, then they move into tier two, which is initial intervention. So if a student's falling short of that baseline, then interventions are put into place in a limited fashion, both inside and outside the classroom. And this is very discretionary based on the district and the student, because every student has different needs and every district does things a little bit differently. So the RTI model does give districts a fair bit of flexibility. So this may look like speech therapy, push in 2 times a week, 3 times a week, or a teaching assistant or resource room help 3 days a week or something like that. So it's kind of some initial intervention to see if a little extra help can help the student reach those baseline levels that were set by the universal screener. And then tier 3, if a student is not responding to the initial intervention and things, they continue to struggle, Then tier 3 is the maximal intervention and a referral for diagnosis. So that basically puts into effect full maximal support 5 days a week in whatever area they're struggling in. This could be outside of school too. It could be a referral for extra programs after school or extra help after school. And if the student fails to show marked improvement in this tier, then they get referred to a psychologist, and oftentimes a subsequent diagnosis likely follows in that situation. So you have these two different models, the ability achievement, which kind of sets a baseline, and if they fall short, they get referred. And then you have the response to intervention model, where we identify that a student is struggling and we go through different tiers and steps to try to get them the help they need before immediately recommending them for a diagnosis of a learning disability. So like I said, more and more schools are moving towards RTI and away from ability achievement because it tends to catch students earlier in their academic careers when they're struggling. So the implications for instruction for this. This is something that we all have to learn about and understand because the number of students with classified disabilities across the board is growing. And that's not because more people have disabilities now than ever before. It's because we're expanding our assessment and diagnosis criteria. So we're more effectively and appropriately diagnosing people with disabilities and getting more of them the help that they need. So I found this statistic interesting. Approximately 19% of all undergraduate students at US colleges and universities report having a disability, not specifically learning disabilities, but a disability. So that's already a fifth of the college population, and many of those students came into school with that diagnosis. So that's a significant amount of students. And recent studies also indicate that up to 10% of the world population has a non-apparent or not visible disability, and this includes conditions such as learning disabilities. In many instances, these non-apparent disabilities will go undiagnosed through childhood and may not be recognized until later, until adolescence or adulthood. A good example of this would be my oldest brother, Ben. He did very well in school through middle and high school, and he actually graduated top of his class. He's a valedictorian, never really had trouble with that. He got to college, and when the structure was less rigid and the expectations were less direct, he found himself struggling to pay attention. He found himself struggling to get the same grades that he was used to. And eventually he was able to see a psychologist and then go to the doctor, and he was given a diagnosis of ADHD and a prescription. And that immediately changed things for him. It turned him right around, and suddenly he was able to focus on classes and organize his time and his work a lot better. And college got a lot smoother for him at that point. So some of these don't get caught in childhood. Some squeak through the cracks. So this means that teachers, both in general education and special education, wherever you decide to end up, must be prepared to accommodate students with these needs. We all have to learn these things so that we are prepared in the situations that we're likely going to find ourselves in. So when that does happen, here are some tips and techniques that I found to kind of just, they're broad, they're fairly general, but I think good classroom tips and techniques for students with learning disabilities. So number one is communicate with the parents, for sure. That's pretty standard for teachers, but more often than not, or not more often than not, but there's plenty of times where their communication falls short with parents and they become frustrated with the teachers. So be a good communicator. Nobody knows your student more than the parents. So stay in constant communication with them, keep them updated so that they feel included in the educational process, and assist with strategies that work at home, because they may know some tricks themselves that can help you in your work at school. Use visual aids. A lot of students with learning disabilities often have trouble absorbing and retaining large amounts of written text. And as they get older and the content gets more rigorous in middle and high school, there tends to be more text and less pictures. So supplement that text with different visuals, because that can be more engaging and help kind of instill a deeper understanding of whatever topic you're covering. Be patient. Sometimes progress comes slowly, and you may not see week to week these big jumps. And it may take a whole quarter or half a year or even a full year to see just a slight bit of improvement. But just be patient, stay positive with your student, and they will get the most out of your instruction. Number 4, give clear and explicit instructions. Students with learning disabilities already have a hard enough time with the topic at hand that you're working on with them. So you need to be very clear in what your goals are and what you expect of them. So keep your lessons straightforward, and with these students, avoid a lot of ambiguity in your instruction. They need to know exactly what's expected and what the goals are. And then 5, give them space and time to share and participate. Nobody likes to be talked at, as I say that, talking at all of you right now. But nobody likes to be talked at. So give that student that you're working with plenty of space to share their ideas and explore the current topic so that they feel more responsibility and ownership for their learning. This also allows them to have a little bit, maybe more some creativity where they can generate new ideas or bring in, outside references to whatever you're working on and make connections to their real life. But at the end of the day, we all have to remember that kids with learning disabilities and kids with any other disabilities are still just kids. They want to be treated like everybody else. They don't want to be ostracized. When we do give individual services, sometimes it's hard to help a kid not feel like they're different or standing out from the crowd. But we need to try as best we can to affirm that they're still good kids and that they're just like their friends, and that we're just giving them a little help here and there to keep them in step. So they're just like kids, or just like all other kids, just like everyone else. So that brings us to our questions for you to think about and answer. So the first one, what is one positive and one negative of the response to intervention model that we talked about earlier in this slide? So on the right side, the response to intervention model. Obviously, schools are switching to it, so there's some upside to it. But I would like to think about maybe what is a drawback of this model and how could it be a little bit better. So what's one positive and one negative? What is one other tip that you could suggest for working with students with learning disabilities after watching this presentation? These are 5 generic tips and techniques that aren't incredibly specific. I think you could use these with students with other disabilities or with your general education students, but maybe try to think of one more tip to add to that list. Our third question, what is the educator responsibility if they suspect a student of having a learning disability? So if we suspect a student may have learning disability, what do we do about that? What are the next steps? Where do we go from there? So think a little bit about what we can do to help in the process. And number 4, do you believe all people have a certain type of learning disability? We all have subjects that we are better at than others. I'm a history person. I'm not a math person. So does that necessarily mean that I have a learning disability in math? It's a question worth thinking about.
No.
Because what designates enough of a gap to be qualified for a learning disability? So it's an interesting question to think about. So those are our 4 questions. Feel free to answer those. And then these are our works cited. And hope you found this presentation informative. And thank you for watching through till the end. Let us know with any extra comments or questions that you may have. Feel free to email either of us if you would like to know more. Thank you very much.
Thank you. Yes.